So today what we're going to do, similar to the brainstorm that we just went through now, we're just going to cover the different kind of services that are within our community that help to support the different dimensions of health and well-being. So if you remember from unit 1 and 2, and what we've been doing so far, the different dimensions are what we just looked at before. So you've got your physical, mental, emotional, social, and spiritual there. Okay, so these are the different community services that we're going to go through. And as you can see, we've already looked at some of them in when we did our brainstorm. So a lot of you mentioned sports courts and gyms and that kind of stuff, which come under sports or recreational clubs. A lot of you also mentioned like mosques, for example. Okay, psychologists and mental health organization also comes under that, as well as doctors, dentists, and hospitals. So we all know this memory tip. I think by now we should have it ingrained in our head, PMES. So that's our memory tip for the dimensions of health and well-being. Okay, so these are the different community services. And on a SAC or exam situation, you could be asked about any of them. Sometimes we might give you a choice, but sometimes we do ask you for a specific one. So just make sure you have an overall good understanding of each of them. So the first one is called conventional medical services, doctors, dentists, and hospital. I don't know why that's done that. Hold on. Why has that gone to the next line? Let me just fix that. Otherwise, it'll annoy me the whole time. Okay. Conventional medical services, so doctors, dentists, and hospitals. Now, we know that, like I said before with the example, if you go down any strip of a road in any suburb nowadays, we've got so many medical centers. Okay, medical centers are basically places where GPs practice. Okay, a lot of your doctors tend to be situated within medical centers nowadays compared to private practices. And it's not just doctors in these medical centers. If you've ever visited your local medical center, they might also have a dietitian that works there. Okay, they might also have, for example, a pathology. So you might go to your local medical center to get a blood test. Okay. So those things are available in medical centers. So medical centers are kind of not just a place where doctors do their practice now, but it's actually like a one-stop shop for all your different health services. Some medical centers, I think there's one in Williams Landing, even has like a dentist attached to it. So it's like literally a one-stop shop. It's got everything in it. Okay, so medical centers can provide you with a range of your conventional medical services. Can anyone take a guess as to what the word conventional means? When we say that something is conventional, what do you think another synonym for the word conventional could be? Yeah, it's useful. Okay, it's traditional, it's typical. So it's something that we know, it's tried and tested. Okay, a conventional way of doing something is a way that everyone has been doing something for a very long period of time. So in other words, a lot of the time people, when it comes to doing like trial exams, for example, there's a conventional way to do trial exams, which is to literally just print them out and do them pen and paper. The non-conventional way, which we have had to force ourselves to adapt to nowadays, is doing everything online, okay, which was hard in the beginning, but I think by now we've adapted. So we moved from a conventional or typical way of doing something to doing something online, which is not as typical or not as traditional for us. So conventional medical services are basically from the beginning of time when people got sick, they used these services to get better. So we're talking about doctors, talking about dentists, talking about hospitals, okay? These are not recent developments in the medical system. These are things that have been around forever. That's why we call them conventional. So that also includes specialists. For example, if you've got a heart issue, you might go to a cardiologist, and that's a person who specializes in heart issues. They've probably studied like, many, many years, for many decades, and they've probably treated some of the most extreme heart conditions. These guys are also, responsible for referring you to things like heart surgery and stuff. And that's something normal doctors don't usually do. Public and private hospitals are also a big part of your conventional medical services as well as your ambulance services and your dental services. And we know from last chapter that a lot of these services like ambulance services and dental services are also covered by your private health insurance. And we're going to watch a quick video about that to recap that knowledge. And our conventional medical services are good because they help us to diagnose and treat conditions. Okay, diagnose means that if I have, a sore leg, I go to the doctor and the doctor says, okay, well, you've sprained your ankle or you've sprained your foot. And then he gives me a treatment. So he says, okay, here's a prescription for a specific type of anti-inflammatory cream or ointment that you can use for a few days. Here's a, muscle support kind of, what do they call them? Those things that people wear, they kind of look like socks, but they actually support your muscles. So basically he might give me some kind of treatment to help me, get better essentially. Now, services like dentists, they target your oral hygiene and your dental health. So if you've got cavities, they can often pick that up when you go for a checkup, and they can try to fill those cavities, and that will help you to prevent like losing a tooth, for example. Public and private hospitals are important, and we know public hospitals are covered by a specific part of our healthcare system. Does anyone remember from chapter 10 what the name of that system is? What are public hospitals covered by? A special part of our healthcare system that only Australian citizens and residents can access. I'll give you a clue. Yeah. Someone said Medicare. Yeah, Medicare is correct. Okay, Medicare is what is covered by, Medicare is what covers our private health, public health hospitals and public health services there. Okay, they're important because whenever you've gotten to the point where you really need life-saving treatment, or you really need to be seen by a doctor or a nurse or something like it's an emergency, it's very urgent, you can go to a public or private hospital and be taken into the emergency room. Okay, and that can basically help to prolong your physical health by improving your life expectancy. Okay, so that's just a few examples of how. You don't need to know all these examples. If you know any 2 examples, it should be enough. So you can either learn an example for how doctors help us, or how dentists help us, or how hospitals help us, any 2. Okay, so hopefully if there's any issues about this slide or any questions, just let me know. If not, I'll just keep moving on. So we will watch the video first thing about the conventional medical services. It's just a recap of private health insurance. So what I'll do, I'll just pause the recording here and then we'll watch the video. Another one that a lot of you mentioned in the brainstorm was sports or recreational clubs. So like gyms, sports courts, that kind of stuff, walking trails, bike paths, all those kinds of things are really important for us because they do provide an opportunity for the more physical or sport related activity that people do tend to enjoy, that people do tend to benefit from. Generally, we know that when you're involved in some kind of sports club or any kind of sports, that does increase your physical fitness. It increases your flexibility in your muscles, so you're less likely to experience joint issues as you get older. And overall, when you're playing in a sports club with a bunch of people who are your teammates, you feel a sense of social cohesion and togetherness. Okay, and that really helps with your sense of social well-being as well as spiritual health and well-being, because spiritual health and well-being is about a sense of belonging to a group of people who have the same values as you, who love soccer just as much as you do, or who love playing basketball just as much as you do. Also, when you participate in a recreational club, which could be something like a gym, but it could also be anything that's recreational, anything that you do as a hobby. So something like art club, music club, a choir. Okay, all of these clubs can also help you to feel less stressed. Okay, a lot of people listen to music when they're stressed, or, paint something when they're stressed. Okay, people have different ways of dealing with stress. And so participating in recreational clubs like these can actually help you to reduce your stress. And as a result of that, it can improve your mental health because you're less stressed and anxious, and it improves your emotional health and well-being because you're feeling more positive emotions like happiness rather than emotions like pent-up anger or frustration or disappointment there. Okay, and generally those experiences give you a sense of joy, which is also why they promote your emotional health and well-being. Okay, so I think we have another video to watch now. So what I'll do is I'll quickly pause the recording here. So you might have already heard of Headspace before, but Headspace is basically a mental health service within the community. And it basically provides young people with accessible mental health support. We're generally focusing on the age gap between 12 years to 25-year-olds. Okay, these are mental health services that are provided in an accessible way. Most of the time it's free, or it's very, very low cost. We know that young people don't earn very high incomes. And so they can't afford thousands of dollars to a psychologist who has their own private practice, who might be charging a lot. So Headspace still employs real psychologists and real counselors, but it allows those services to be accessible for young people in ways that are less intimidating in ways that are less stigmatizing and in ways that are a lot cheaper and more affordable for them. So Headspace provides support through their website. They provide online counseling. If you're too embarrassed to go face-to-face, you can always do online counseling. And they also have Headspace centers. In fact, I think the closest one to our school is probably in Werribee. I'm not sure if it's closed, but there's a lot of Headspace centers all around Australia. And these Headspace centers have been designed or have been structured with young people's ideas. So they actually ask young people, what do you guys want to see in a Headspace center? What would make you attend? What would make you feel less intimidated? And so they designed a lot of these Headspace centers to be quite modern, okay, to be quite, how would you say, youth friendly, okay, rather than being something like very clinical or very scary looking. And through these centers, you don't only have access to psychologists, but you also have access to doctors. A lot of young people have issues with drug and alcohol. So drug and alcohol workers also are employed at Headspace centers, social workers, as well as counselors. And like I said before, a lot of these services are either free or provided at a very low cost. The most obvious dimension of health and wellbeing that Headspace would address is mental health, obviously, because when you go to Headspace, you're less worried and you're less concerned when you're able to discuss your issues with someone who you know is a psychologist. And obviously, because it's not costing you a lot of money, that further helps to reduce your feelings of anxiety and stress. Okay, it's always good to talk to a third person about something that you're dealing with or something that you're going through. Headspace can also promote spiritual health and well-being, particularly because many youth have issues related to who they are, their identity, what they're going to do in the future. And all of these things can help you to develop a sense of hope for the future. When you're sitting with your psychologist or your counselor and you're discussing your plans, they're able to kind of give you better advice there. Okay. Where's the bell going early? That's weird. Anyway, so that's basically helping to promote your spiritual health and well-being, helping you to find your sense of purpose, your sense of hope, and your sense of belonging. Okay, we're going to watch a quick video just to introduce you guys to Headspace. And I think after that, we're almost done. Okay, let me just was the places of worship. So a lot of you mentioned that, mosques or, like churches, those kinds of things can help us to improve our spiritual health and well-being. And that's absolutely correct. When we are, meeting up with people who share the same religious values as us, we generally tend to form new friendships. Okay. We meet people at those religious places of worship there. Okay. And that not only promotes your social health and well-being, but also promotes your spiritual health and well-being, because you feel like you have a sense of purpose. Okay. In fact, people who, I think there was a survey done, and people who subscribe to a religious affiliation, whether that's Islam, whether that's, Christianity, whatever it is, they generally tend to be less scared of things like death, less scared of disease. Okay. Obviously, everyone is scared of those things, but these people know that there's a higher purpose in life and that they've got this kind of belief system that they can go back to. So they feel like there is a different purpose or point in life compared to someone who doesn't maybe subscribe to a specific religion there. Okay, so places of worship can really help to consolidate their social and spiritual health and well-being in that sense. Okay, before we watch the video for this, I'll just go through the last one and then we'll watch the last two videos as well. So the last thing that we're looking at in the community is volunteer organizations. A lot of you might not have had had to rely on a volunteer organization, but if you're someone who's really elderly or someone who has like disabilities, for example, these are the people that generally tend to rely on volunteer organizations. Okay, people who rely on others for help, who need that extra support. They're not completely independent by themselves, but they rely on a volunteer group to remain living as independently as they can for as long as possible. Meals on Wheels, which we'll watch a quick video about, is one example of a volunteer organization. And what it does is that it prepares meals for people who cannot cook by themselves, maybe because they don't have a proper kitchen, maybe because they don't have the physical mobility or the physical ability, because maybe they've got arthritis in their hands or in their wrists and they don't have that ability to lift heavy pots and start cooking. Okay, and a lot of the time Meals on Wheels can provide people meals on a short-term basis. So let's say you've sprained your wrist, you can't cook for about 3 months. They can provide you meals for 3 months. If you're someone who's got a chronic disease, like, you've got an actual condition like arthritis and you're living with that for your whole life, they can also provide meals on an ongoing basis. So Meals on Wheels is just one example of a volunteer organization, okay? Regardless of what volunteer organization we're talking about, though, those volunteers have regular contact with their clients, okay? They monitor the social welfare, which in basic words is how those people are doing, okay? Along with their physical health and well-being and their nutritional needs. So for the elderly, the physical health and well-being is also supported by ensuring that they have those adequate and nutritional meals provided. Especially with the elderly, you've got to ensure that they have proper nutrition, that they've got meals that are high in energy to provide them with their energy requirements there. Okay. And the social health and well-being is also affected because each time you're an elderly person and you're visited by these volunteers who are delivering your meals, you're able to talk with them. You're able to, talk about your life with them. They check in on you and they basically ask you how you're doing. And so that really helps you to, as an elderly person, when your family's maybe living far away from you, avoid those really high feelings of loneliness and experience this sense of social interaction that you otherwise might not have. Okay, so that's how volunteer organizations can help to improve social health and well-being. So what we'll do to end off today, guys, is I'll just stop the recording here and we'll watch those remaining 2 videos.